Hi everyone. Prescription writing is one of the essential skills every doctor must know. A small error in writing the prescription can lead to the major harm to the patient. So let us understand in today's video what are the common mistakes in prescription writing and how you can avoid it. First of all, why prescription errors are important to recognize. If there is a mistake in writing the prescription, then it can lead to the failure of the treatment. It can also lead to the adverse drug reactions to the patient. It can also increase the patient morbidity and mortality. It can overall increase the healthcare cost to the patient. And sometimes doctor also has to face legal consequences for this type of prescription writing errors. There are 5 types of the prescribing error. Watch this video till the end to know what are these 5 types of the prescribing errors and how to avoid them. So let us begin. So the first type of the prescription writing error is a patient details related error. Sometimes doctor may forget to write the details about the patient. So these include the name, age, weight and gender of the patient. Then sometimes no diagnosis is mentioned on the prescription writing and no indication is mentioned on the prescription for what this drug therapy is being prescribed. So if you miss to write about all these details of the patient, then this can lead to the prescribing of the adult dose to the child, and this can lead to the major adverse drug reaction in the child. So that is the reason you have to always write all the patient details when you are writing the prescription. The second type is the drug related errors. These include wrong drug choice. For example, the patient has been diagnosed with the viral infection and you are prescribing antibiotic. So antibiotic in the viral infection is a wrong drug choice. Then irrational drug combination or polypharmacy without indication. That can also result in adverse drug reactions to the patient. Most of the cough syrups which are available in the market, they are also the type of the polypharmacy, and these are all the irrational drug combination, and the doctor should not prescribe this type of the irrational drug combination, or prescribing two drugs from the same class which are having the same effect. That is also the type of the irrational drug combination. For example, diclofenac and aspirin, both of these are the NSAID group of drug, and both these drugs are being prescribed for the treatment of fever. So that is also a type of irrational drug combination. Then the name of the drug, sometimes it may be written in a abbreviated form, and that can also create a confusion when the pharmacist dispenses it to the patient. So for example, CPM for chlorpheniramine, CPZ for chlorpromazine, AZT for zidopudine, that can be mistaken for the azathioprine. So this type of the mistakes can happen when you write the short form of the drug. Now coming to the sounder like drugs. So there are several drugs which sound similar when you speak it. For example, hydroxyzine and hydralazine, bupropion and buspirone, Zentec which is a brand name, and Zyrtec which is also a brand name. So when you are writing this type of the drug, you have to write in very clear and legible handwriting. So lookalike drugs are the drugs which are having the similar pharmaceutical packaging. So for example, vancomycin and acyclovir, then ephedrine and adrenaline, hydralazine and hydroxyzine. So these drugs are having the similar packaging. So this type of the drug can create confusion to the pharmacist while dispensing of the drugs. Now coming to the dose and administration related errors. So these include incorrect dose. If you write incorrect dose, then it can lead to the adverse drug reactions, or sometimes it can also result in lack of effect. In the children, if there is error in the dose, then it can lead to the serious adverse effects in the child. So you have to be very careful when you are prescribing the drugs, particularly in the child and also in the geriatric patients. Never ever prescribe with the help of the non-standardized unit, for example, teaspoon or tablespoon. Avoid such non-standardized units. Then while mentioning the duration of the therapy, avoid the time period. For example, dispense for 1 month. This type of the terminology you should not write in the prescription. Instead of this, you have to write specific quantities, that is dispense such 30 tablets. And when you are writing this type of the sentences, you have to also write in the number as well as in the words. So that makes sure that how much exact quantity you want to prescribe to that particular patient. This type of the Latin abbreviations may be difficult to interpret and understand by the patient as well as for the pharmacist. For example, PC, which is post sebum, which means after food, or OD, omnidai, that means once a daily. So these type of the Latin abbreviations, if possible, you should not use. If you want to use such Latin abbreviations, then you have to also mention what this Latin abbreviation means. Now the other type of the dose and administration errors occurs due to the use of the decimal points. So unnecessary decimal points before the numerical value you should not keep. For example, 2.0 milligram, this may be mistaken as a 20 milligram. So you have to write it only as a 2 milligram. Zero point 0.1 gram may be mistaken as a 1 milligram, and the correct way of writing this type of value is 100 milligram. Then 0.5 milligram, it can be mistaken as a 5 milligram. So you have to write this as a 0.5 milligram. 10 unit, it may be mistaken as a 100, and you have to write in full form 10 units. 10 international unit, it may be mistaken as 10 IV or 101 unit. So when you are prescribing this type of dose, you have to write 10 international units in a full form. Quantities less than 1 milligram, write as a micro or nanogram. Do not abbreviate micro or nanogram. Write 100 micrograms and not 0.1 mg or 100 mcg or 100 microgram. So you have to write in a full form. Use ml or m capital L for the milliliters. Sometimes the dosage form are also completely missing, or if it is written in the short form. For example, tab, cap or INJ, and this can lead to the dispensing errors. So write the full form, that is tablet. So this is the correct way of writing the prescription. This type of the mistake in the dose or dosage form, it seems very small mistake, but these can lead to the serious harm to the patient. So you have to be very careful when you are prescribing to the patient the particular dose and the dosage form. Now coming to the third type of the error, that is the writing related errors. Writing the prescription with the help of the pencil or erasable ink can lead to errors in dispensing, and also it can lead to difficulty in understanding by the patient. Illegible handwriting can create confusion of the drug name, and that is particularly true for the similar names. For example, metformin and metronidazole. Striking, scoring or overwriting, these all type of mistake you should avoid when you are writing the prescription. The most common drug errors are incomplete drug instruction. For example, take as directed. So direction to the patient should be very clear. Sometimes physician does not explain to the patient how the drug should be taken, or they explain in a hurry, or sometimes the patient does not understand, or they understand in an incorrect way. So all these mistakes can occur. So to avoid this type of the mistake, physician should also explain to the patient, and at the same time it should be also written in the prescription that this particular drug, how it should be taken. Now coming to the fourth type of the prescription error, and that is safety related errors. Sometimes in hurry, doctor forget to ask the patient about the allergic reactions, and this may be missing on the part of the prescription due to inadequate drug history. No specification on number of refills or about the storage of the drugs is mentioned, and drug interactions may not be checked, or contraindications are overlooked. All this can result in a serious type of the adverse drug reaction. For example, aspirin, when it is given in the peptic ulcer patient, it can result in a serious bleeding to the patient. So you have to always check for the drug interactions and drug contraindications when you are prescribing to the patient. Now coming to the fifth type of the prescription error, and that is the legal and documentation errors. If the prescription is not having any date or signature, then it makes that prescription invalid. No registration number, again that also makes the prescription invalid. Another common type of the error is writing the brand name instead of the generic name. So doctor should always write the generic name, and generic name always should be written in the capital letters. So these are the 5 types of the prescription writing errors and how you can prevent while writing the prescription. So prescription errors, although they are common, but they are preventable. So how you can avoid this type of the errors? Follow standard prescription format, write in a clear handwriting, or if your handwritings are not good, then you can use computer generated prescription. Use generic name of the drug as much as possible. Double check the dose and drug interactions for the patient safety. At the same time, you have to also educate the patient regarding the drug intake. So to summarize today's video, the common errors while writing the prescription are the patient related, drug selection related errors, writing related errors, safety related errors, and legal or documentation related errors. So if you want to avoid this type of the prescription error, always write a good prescription, clear, complete, rational, and patient specific. For more simple and practical medical topics, subscribe my channel. Thank you.